So we're here at the MedRex, or the Medical Readiness Exercise in Senegal in Africa. Senegal is one of our state partners with the Vermont National Guard going back to 2008. And this year's MedRex is a joint trilateral event that includes nearly 40 participants from the Vermont and New Hampshire Army and Air National Guards, as well as medical providers from the Austrian Armed Forces, which, like Senegal, is a key state partner for the Vermont Army National Guard. On the Senegalese side, we're working with regional hospital teams in Tambacounda, Goudiry, and Kedougou. And we also have military medical providers from the Senegalese Armed Forces working alongside our teams directly in the civilian hospitals.
So the first day it's always a little more challenging the first day because they're getting to know us, we're getting to know them. But now day 3, we're getting in the OR, we're actually assisting, we're getting our hands in and helping out, and they just let us jump in. So we're all getting to put hands on patients.
My medic, Alex Gravel, and myself are working in the NICU as well as the pediatric ward. So we're doing a lot of standard care, vital signs monitoring, as well as some interventions. Yeah, mortality, morbidity is fairly high here in Senegal, especially at childbirth. Some of these mothers have higher risk at things like preeclampsia and other diagnoses, and unfortunately, we had one mother pass away at birth, and so it's definitely humbling.
So for this exercise, I'm working at the regional hospital in Tambacounda. It's a hospital that you might think of almost as an open air hospital. Think about waiting rooms that are out in the open, and so patients wait outside in sun covers. We're here in the maternity section where we're in a small room that's used to do fetal ultrasound. So we bring pregnant women in, I do an ultrasound on them, and then we report out to the obstetricians what we found.
So you're looking at the baby's head.
So a few minutes ago we were outside and we engaged in conversation with a lady who walked up and started asking about why her belly might be growing in the setting of a negative pregnancy examination. She said she'd been on birth control for 5 years, but thought maybe she was pregnant. Meanwhile, as we started talking with her, some other patients saw there was interactions going on, and we sort of got a mini mob of patients, one asking about some trouble with her eye. And pretty soon we had a little kind of mini clinic going in the courtyard, which probably was not the ideal circumstance. So after we answered a couple questions, we excused ourselves back into this part of the hospital. We were waiting for patients here at the time.
I got the chance to see this hospital here in Tambacounda, and they do many things different than we do at home due to lack of equipment or resources. So you can really learn from them how to improvise and how things can be done with much less resources.
At the end of the exercise, it's almost like we've been here for months. Like, the teams are so well integrated. Both sides learn to overcome the language and cultural barriers and really learn to operate as one integrated team, focus on providing the best medical care to the patients out here, which is important because we never know when in the future there may be a global or international medical emergency where we find our teams or similar teams having to work together across different cultures.
Something that's going to definitely stick with me going back home to the States is me and the other airmen have ventured outside of the hotel as often as we can to interact and engage with the locals here, and I'll never forget playing soccer with the kids across the street. Me and another airman bought them a soccer ball, and we brought it to them, and we had a giant game with them, and it was fun, and that's really what it's all about. You get to interact more with the Senegalese and the locals, and it's great to see how they live and who they are and get to know them as well, and the people whose lives you're making a change in.